Thank you for joining Leadership Rediscovered, a podcast devoted to all things leadership. I'm Laura Siebold, founder and president of Shine Consulting, and each week I interview different leaders from different walks of life to talk about their unique definitions of leadership. And today I am very honored to have Dr. Hannah Hazard-Jenkins here with us, who is the executive chair, let me make sure I say this correctly, executive chair and director of the WVU Cancer Institute.
Thank you for having me.
Yeah, this is exciting. You are in such a big role and doing really important things, and I'm excited just to hear about how you got started. Before the cameras were rolling, we were talking about, as I was looking, I looked at your CV, and I was so impressed with, first of all, the time that you've spent building in this career, but also a lot of awards and accomplishments along the way. And it made me think about, when you were like 5 years old and people said, what do you want to be when you grow up? Were you thinking the executive chair and director of the WVU Cancer Institute?
No. No, not at all. No, growing up, I actually, when I went to college, thought I was going to be a lawyer.
Really?
Which is, my dad was a lawyer, and but his father was a pediatrician.
Okay.
And I think he'd always wanted to go to medical school, but timing and such didn't happen. And so he told all three of us that there are two professions left in the world, doctor and teacher. And so we were going to have to be one of those two. So, but mostly doctor.
Yeah.
So, of course, I bucked that quite nicely, as the first child would always do.
Absolutely.
And then when I went to college, it was actually January of my freshman year where I kind of had a moment of clarity and realized that's actually what I wanted to do, was to go to medical school. And so then I, put forth, I think that's probably, there have probably been 2 times in my life where I've been very targeted in what I want. That was one of them.
Okay.
And then the other was just surviving general surgery residency.
Can't even imagine.
Yeah. So those were, but that was my decision. I thought I would be a pediatrician. But I quickly learned I liked to play with kids. I didn't like to, do lumbar punctures or something like that. And so I pivoted pretty quickly. And then I hit my surgical rotation as a third-year med student and just kind of felt at home. It was odd to feel that comfortable. But, even at that young part of my career, I felt like I was in a room with my people.
Oh, wow.
And so I tried to fight it, but it didn't work. And I think my thought process was that I would rather do long hours of a job I love than short hours of a job that I liked.
Yeah.
And I trained, and at the beginning of my residency, there were no work hour restrictions. And so we, the first couple years, it was pretty intense as far as hours are concerned. And going through that mental process of really finding that surgery was going to be my choice was helpful when it was really hard. Yeah. Because it was something I'd remind myself, you thought this through methodically, and this is where you wanted to be. So kind of like a suck it up moment and move on. But that was kind of how I ended up in surgery. And then from there, there were specialties I thought I wanted to do, but it was a lot of times it was the people around me, how their mentorship and their personalities that drew me to a specialty, not necessarily the specialty. And so ultimately I ended up getting specialty trained in breast cancer work. And then it's funny, I left the state. I went to Chicago. So I'm born and raised here. So my office is 3 floors below where I was born.
Oh my
at the
gosh,
moment.
that is wild.
So it's
talk about coming full circle.
Yeah, it's really special. I mean, and when I work and recruit, it's one of the things that I talk about. And I've lived in Martinsburg, and I graduated from high school in Charleston. So I'm from here. Yeah. And it's a big driver for me. So that was kind of how I. Wow. But when I finished residency, I was like, I'm not coming back. There's no way. And I sold my house, moved to Chicago, and I got about 3 months in. And, I went to a big university hospital, and the patient population was very different.
Really?
It was a population sort of over-resourced.
Oh,
And
interesting.
it took me leaving to understand that where I wanted to be was at a place where I could be impactful, and what we, not just me, but the team that we build around that, can be impactful immediately.
Yeah.
And in an area where there aren't the resources.
Yeah.
And so I called up my chairman. I was like, hey, you got a job? And he was like, I didn't think you wanted to be here. I was like,
You
yeah,
sold your
well,
house.
technically. So, but yeah, that's kind of how I ended up home
Wow.
in West Virginia.
And been back ever since.
Ever since. Yeah.
Wow.
I started on faculty in 2007.
Oh my goodness.
I just dated myself. But anyway, 2007.
Okay. And then you just continued to, it sounds like, work your way up from there.
Yeah, all unintentionally.
Really?
Yeah, all unintentionally.
Wow.
Yeah. So I was talking to somebody who was looking at my CV, and his comment was, "You look like an opportunist."
Oh.
And he was right. I mean, it was weird because I never actually met him, but he was right. A lot of what I ended up doing was because somebody saw something in me. Mm-hmm. Mm-hmm. And that I probably didn't see in myself.
Yeah.
And that was kind of, so that the progression that you see on paper is very unintentional.
It wasn't like a calculated,
No,
okay,
never.
at this point I want to be
Absolutely
this,
never.
and then that.
Absolutely
yeah.
never.
That's amazing.
Still never.
Yeah. Yeah.
Still never. Well, that's not true. So when I applied for the position for the director of the Cancer Institute, that was the first time in that trajectory that you see where I actually was like, okay, I'm going to do this.
Yeah, instead of someone tapping you on the
Correct.
shoulder.
Yeah.
What about that role caused you to want to actually, throw your hat in the ring?
It's like the ultimate opportunity to help impact or craft or contribute, depending, I think, on how you want to look at it. Yeah. My interactions one-on-one with patients are really important, but they're one-on-one.
Yeah.
And that's a value that's different. And so from the director role, you get the ability to impact on a bigger scale.
Yeah.
And it's a hard mind flip. So when we talk about day to day,
yeah, I was just going to ask.
I like
what is the day in a life like?
I kind of like the purity of one versus the other, because your
Yeah.
brain, it does a little bit hard for your brain to flip between the one-on-one versus the bigger picture. Not impossible, but OR days, very hard. Clinic days, not so bad.
Yeah.
But that was really it. I'm very passionate about the state and the people that we get to take care of. Very humbled by them.
Yes. Yes.
I mean, you think you have a bad day.
Oh.
And so, you see these, for me, I take care of women with breast cancer, a couple men, but women. And it's really inspiring and humbling to see women pull on an inner strength they never knew they had. Women who come in at the beginning who don't really talk, by the end of their treatment, they're, chatty Cathys. I mean, it's really neat to see that happen. And it's a big honor. When I was the dean for admissions and would go talk to potential students, if you really think about it, I walk into a room, I did it a few times this morning, and I don't know them. But in the course of less than an hour, they give me probably more information than most of their family knows about them. And they have to trust you. Immediately. There is no grace period.
Right.
And that's a really big thing. Yeah. And so, using that and understanding human nature and reading nonverbals and all those things are what really help, on the day-to-day. But the director job is on a bigger scale.
Yeah. And when you think about, what level of responsibility are we talking about in terms of, are you setting strategy for for the Institute overall? I would imagine you're managing a large number of people. What falls under that umbrella in terms of what that job entails?
So the umbrella is the WVU Cancer Institute. So the WVU Cancer Institute has roughly 15 sites across the state.
Wow.
Some of those are mobile units. So we have a couple mobile units. One is a mobile mammography unit called Bonnie's Bus, and then the other is a mobile CT lung cancer screening unit called Lucas.
Okay.
And so, but with the regional sites across the state as well as Morgantown, that is the Cancer Institute. And from there, it's managing, and that's actually the wrong word, it's leading. Because at this point, the amount of time you manage should be small, and the amount of time you lead should be higher. But it's leading teams that are focused on cancer prevention, cancer research, cancer treatment. So we're talking about basic science, translational science, prevention science, clinical care. Yeah. So it's kind of all of that wrapped together. And so you're only as successful as the team that you have around you.
Amen.
There is nothing about what I do from a day-to-day basis that isn't highly supported by the people around me.
That's amazing.
Yeah.
And how often are those roles changing out? I mean, are these people that you've worked with for many, many years, or are there a lot of new individuals? What's that mix
So
look
and it depends kind of, I think of myself as having two teams that I'm part of.
Yeah.
So the clinical team is really stable. We've had a couple surgeons coming and going, but the support structure with the advanced practice providers and the nurses, we're kind of we're a tight unit. And we all respect each other's knowledge base. We allow each other to practice to the top of the license. And once you have trust and have gained trust on both directions, then it's easier because they trust you, you trust them, and so there isn't duplicative work.
Yes.
And so that team is my, it's not mine, but the one that I'm part of the longest. The Cancer Institute team evolves over time, and it depends. We have slowly crafted it. It will continue to grow just because of the trajectory of the Cancer Institute moving forward. But it is one that, has people coming and going, but not rapidly.
That makes sense.
Yeah.
You've mentioned the word trust a couple of times, and it's really struck me because I was thinking about, first of all, anytime I do leadership training or I'm working with teams, I mean, trust, as you know, is the foundation of all relationships. And I was thinking about the conversation you mentioned earlier about maybe a new patient who's coming in, sharing all this information with you. I would assume is also probably scared. I would imagine that's one of the many emotions they're probably feeling. How do you go about making that person feel safe or comfortable or building that trust? Because that's tough to do it quickly.
Yeah, I think it's all in how you interact with people.
Yeah.
So, when I was a med student and you would go into a patient room and there was, the chair that the patient sat in, the chair that the attending sat in. And then as the student, there really wasn't a chair, or even as a resident. So I started sitting on trash cans because that was, it had a lid, but but that's where, because that was a place to sit. And so, I still at times I'll sit on the footstep of the exam table so that I'm lower and they're higher, so they're looking down on me, not me looking down on them.
Ooh, that's huge.
And so you nonverbals are really important in life, and so there are those things that you try to do. I have patients I know need me to be very formal in my presence, and I have patients who like to hear me cuss because it makes me real. And so you learn. You learn.
That's amazing.
Yeah.
I think it's also really something that I had never heard or thought about. It's just, it sounds like you get to watch people go through quite a transformation, not even just physically, but it sounds like mentally, emotionally, as they go through that process too.
I think it's the bigger transformation.
Wow.
I mean, I know that a lot of the surgeries that I'll do are externally very different, make women look different.
Yes.
But I think, once they get past that acute event, what's really takes a lot of work is managing the fear of recurrence. Those are very real struggles.
Yeah. Well, that's a topic that I have a lot of conversations about, because I think, if you think about just human nature, I mean, we like control and certainty and stability, right? And I think part of the reason the pandemic was so hard for people was that fear of the unknown. I mean, suddenly a lot of people were just not in a situation where they felt in control anymore, or they had certainty about the future. And, I think there's still lingering effects of that for sure. And you think about the people that you're dealing with every day, they're in that state of, great unknown, great uncertainty about what's to come. And, I never really thought about it until you said it. I'm sure you do have a lot of conversations that are not related to the clinical aspects of care.
Not at all.
Right?
Not at all. Yeah, particularly when you hit the survivorship phase of it, when you have when the busy work is done, and then all of a sudden the realization is I'm not being busy to treat my my cancer.
Focus area.
Then all of a sudden it's like, oh my God, what just happened kind of moment. And so some women are much more vocal about it. Some women are much tighter. Sometimes you get a little window. It's almost like a test dose.
Yeah.
Like there'll be a little phrase they'll drop into the room most of the time as I'm leaving, just to see. I think in part if I heard them.
Yeah.
And then, it's your opportunity to stop moving out and move back in, and then start some of those conversations.
That's amazing. And I love that you do that, because
I'm cognizant of some of them.
Yes.
But I'll never know how many I missed.
Yeah. But I love that you think about it and that you care about it, because, again, I feel like if I'm trying to put myself in your shoes as I listen to you, and I try to think about what your training's probably been like, and I'm sure a lot of it is much more clinically focused, and, we got to get the certain patient outcome ultimately of what we're looking for. And so, I don't know that that's always top of mind for every clinician is, to think about the whole person. And, I remember my son, when he was born, he ended up being, he was critically ill, which was that was a surprise. And I remember when we were being discharged from the hospital, we had a really good cardiothoracic surgeon, and he said, now, here's the deal. He's, from a medical perspective, he's medically cleared, and he won't remember any of this, but you will.
Right.
And now your job is to treat him like a normal child and not put a bubble around him. And I love that he took a moment. I mean, a very busy person, I'm sure, but he took a moment to say, almost like, let me give you a parenting tip of how to act moving forward. And I have never forgotten that, and there has been many moments during my life where I'm like, don't put a bubble around him. Don't put that always stuck with me.
Yeah. I think it's really important. And I think if you put on the director hat, it could be very easy to be singularly focused on treating cancer or doing basic science research. But, my feeling is this is a bigger thing than that. Not that a cancer diagnosis isn't a big thing, but your life changes immediately, and your family's life changes immediately, which is what made me think of it when you say that. So when we talk about doing research and when we talk about investing in programs, those have to come to the surface more often than not, because otherwise you're not really addressing everything that needs to be addressed. And we are not perfect. I'm not sure anywhere is perfect. But you have to constantly work towards that.
Yeah, that's amazing. Okay, I want to shift gears a little bit just to kind of
talk
about you as a leader and shine a light on your leadership style, maybe just anything you're willing to share about how you think about leadership. You already said earlier, you shifted from managing to leading, but I'd love to hear your perspective on how you would define leadership, or what great leadership looks like to you, your leadership style, anything you're willing to share about that.
So, not dissimilar to my career, it's a process and evolution. I got a coach, and he was like, well, what leadership books have you read? And I was like, none. So it's evolving.
Yeah.
I feel very much that the decisions that I make in this position have to be about the organization and very much not about me.
Yeah.
And I feel really strongly about that. I feel very strongly that that what I do over the course of the directorship and the team does as a result should build a foundation and a trajectory so that when the next person steps in, you're not starting all over again. And if you keep in mind who we're taking care of, then that becomes much easier.
Yeah.
So we are focused on West Virginia, Appalachia, the region.
Yeah.
So Lucas is a great example. So Lucas is it's a mobile lung cancer unit. It's actually a ginormous 18-wheeler that rolls around West Virginia's back hills.
Oh my gosh.
Because lung cancer screening is really not well adopted. So of the eligible people in the state, probably only 4% actually get screened. So it's
really,
and there are a whole host of reasons. First in the country it's not the first lung cancer screening unit, but it's the first one that is completely independently powered. So we don't do this, but if you were rolling down 79 and wanted to stop at the rest stop, we could fire her up and screen. It's that independent.
Oh my gosh.
But that was very much for West Virginia.
Yeah,
right?
You were really intentional.
Very intentional.
Yeah.
But what happened is people heard about it and people started calling. So now we consult a bunch across the country. We've had, large cancer centers come in. We've had some calls from Europe and a couple other places just asking how we did it and operationalize it. And so I like national recognition in that direction.
Yes.
Because it comes from here, it's right for here.
Yes.
And then it can be adapted elsewhere. And so when, we're not the very large cancer centers in the country. Sure. We will never be that.
Yeah.
But we are very much Appalachian. And so when we talk about research programs and we talk about clinical programs, it's very targeted toward this population.
Well, I love that the focus is on your patients and future patients and the population that you're serving, as opposed to, we're not the #1 cancer center in the world, but we're going to be in 5 years. You could very easily, I'm sure there's a lot of people sitting around and at organizations saying, let's set a goal to be, to achieve this certain ranking or whatever. Right. Not that you don't care about that, but I just think your priorities definitely seem to be more focused on, who are really the population that we're serving, as opposed to what we want to be recognized for externally.
I think that's true. And so if you talk about leadership style, I think the first is what we just talked about, which is thinking about perpetuity. So it's everybody uses it as a catchphrase, but it really is the infinite game.
Yeah.
It really is, because you're taking care of generations of cancer patients, and what you build now builds on that in the future. Yeah. So I think that's really important. And I also think knowing your purpose will drive you. I tend to be more hands-on. In fact, I probably should be less hands-on, because I feel like if I'm asking somebody or somebody's doing something, I should also be able to do that. And it's been interesting working with, a coach and others, and sort of say, okay, I know what you're trying to do, but look at it from somebody else's angle and say, and the thought is, well, if she's in that position and she has to do that, what are they going to make me do, or what's she going to make me do? So it's been a little bit of a frame shift in my brain. To be able to sort of figure out where that balance is.
Yeah, it's I can imagine that too. And I think, well, first of all, just for what it's worth, not that my opinion matters, but I would say don't pull back. I think it is important for people to see that their leader's not asking them to do something that they wouldn't be willing to do. But I'm sure it is common, especially as you continue to rise through the ranks within an organization, to start distancing a little bit more or detaching a little bit more. But I think it's important for people to feel connected.
It's a perception too. So I think the other, I mean, you kind of hit on it. Like, I mean, I think of myself as a West Virginian, a mom, a surgeon, you know, completely imperfect, who happens to have a big job. But that's not, I think, that's not the way it comes on the flip side. You know, like I'm the girl who's outside, you know, cleaning up after my dogs on a Saturday morning, right?
Yes.
But that's my own perception of myself. And so I have to be cognizant. And I think one of the other things that I never thought about particularly, but again, my coach sort of brought to light is, it's kind of weird, like, but there aren't many females that sort of do this.
Yes.
And so I've brought upon myself unintentionally, and, you know, happy to wear the mantle, but being somebody that you can, as a young, you know, surgeon, a young whatever, you can sort of say, that's kind of, yes, it's possible, or yes, you can do that. And which, again, not at all intentional, but I have to be cognizant of it.
Yeah. Well, and you know, there's probably, again, there's great awareness that comes with that, but also maybe an extra responsibility that you then feel, not that you would have expected that, but like, oh, I didn't even realize, you know, now people are looking at me as this, you know, token person representing this group. I'd love to stay on that topic for a little bit if you don't mind, just because I do think, I had a guest on this show one time say, you can't be it if you can't see it. And that really stuck with me as you think about just, you know, children growing up, careers, but then even once people are in careers, you know, not always knowing what's possible. And I think there's so much conversation about women in leadership roles. How do we get more women in leadership roles? And, you know, we could talk for hours about that. But I think one of the things that can be a real challenge is just oftentimes as you take on additional levels of responsibility and leadership in an organization, there are also sacrifices that you have to make personally. And a lot of times I think moms in particular feel like I'm being put into a situation where I have to choose between my career and my family. And, you know, I'm either not going to be in a position to choose, or, you know, I don't want to have to do that in the first place. So I'd love to hear your thoughts just on how you've managed that, you know, as a mother, you know, just as you've grown in your career and how that's factored in for you, recognizing that everyone has their own personal experience.
No, I agree. I would tell you probably first and foremost, it's having an amazing, supportive husband. I mean, I don't know if that's what most, but hands down.
Yeah. That's huge.
Always supportive, whether it's, you know, do you apply for this job or don't you? Or, you know, taking our daughter to school every day because I'm at work. You know, that is, I think that makes it much easier.
Yeah.
And whether it's, you know, a supportive spouse or a supportive family or a supportive, you can't do everything by yourself. No. And you have to have people that kind of rise you up and smack you down when they need to.
Yes. And families are good for that.
Yeah. And you know, you need, you know, having that around you makes things a lot more possible.
Yeah. Yeah.
So I think that, for me, that's the part of it. It is tricky.
Yes.
It is tricky.
It's like Tetris every day, isn't it?
Kind of. It is. And like I was saying, I mean, I don't think so this is my other thing. There is no such thing as work-life balance.
I agree.
Right?
Yeah.
You don't spend 50% of your time at home and 50% of your time at work.
Yeah.
Right? I mean, maybe you spend more at home, but half of it's sleeping. So,
right.
So where I think it's important is when you get comfortable with where the imbalance is. And then when that imbalance shifts and you become uncomfortable, you have to sort of think, is this a temporary uncomfortableness or did something shift either internally, externally, that has created this sense of further imbalance and then having to address it.
Yeah, and just being aware of that. Well, and also recognizing that what's most important to me now might
Very
not
different.
remain 5 years from now.
That's
right? My needs and my priorities may shift. The needs of my family. You know, I remember thinking when my son was little that it would get easier as he got older. You know, he'll be less needy as he gets older.
No.
But now it's like, well, wait a second. You know, he's getting ready to start baseball, and it's like, I don't want to miss these games. You know, he's in high school now, so that clock has started for me of like, oh my gosh, I have so many years left, and then you know he's flying the nest, and it's like I don't want to miss any of this stuff, you know. And so here I thought it would, you know, there would be less things that I would feel like I was missing out on the older he got, but. No, it's just you enter those different stages of life.
It's different. And I think you're right. I mean, your priorities change over time. And again, you have to be conscious of that they are and should be changing.
Yes.
You know, and sometimes that imbalance between work and home flip. And I think if you've built, again, trust and reputation of being a hard worker at work and something happens at home where you aren't as present, then there's grace given. And then vice versa when you're at work a little bit more and then your family gives you a little bit of grace. So
that is a really important point in terms of just building credibility with people and being consistent so that when something happens that's maybe inconsistent with your normal operating, you know, process, people recognize, okay, this is just a momentary blip on the screen and it's not the standard behavior that we've come to expect from this person. Which makes it, I think, sometimes easier to manage and cope with.
Yeah, I agree.
Wow. So what advice would you give? Let's say, you know, if you could hit the rewind button and go back maybe even 15 years ago, think about someone, you know, in the role you were 15 years ago. What advice would you give to that individual, or, you know, things you wish you had known at that time that you think differently about now?
I mean, it's a great question. I think staying just true to who you are and not blaming the world around you or being very much internally focused in what you want to do. For me, it's my personality, but by not saying at the age of 5 I want to be such and such takes a little bit of the pressure off. And I think, you know, the road that I took even into medicine and once there wasn't a straight line. And being okay with it. Because sometimes those little glitches actually present with substantial opportunities. And if you get so bogged down in what your younger self thought your older self would look like, then I think that brings a sense of angst and you might miss something.
And feeling like I've somehow failed or, you know, fallen short of the expectation that I set for myself. You know, it's like not even
unrealistically when you were 5, you know. So
and then recognizing, because it's so interesting to me. I love hearing people's career stories and their career journey. And a lot of people do have more of a zigzaggy type approach, and they'll sometimes be very apologetic or be like, oh, I know it sounds ridiculous that I did this and then I did this. But when you look at the pattern or all the steps, a lot of times it's like had you not had all those opportunities, it wouldn't have led to the success that you have now. Or, you think about all of those experiences that you've had that you can probably leverage in what you're doing right now.
Yeah. I mean, I think that's 100% true. I feel pretty strongly that, every experience that you have, good or bad, makes you the person that you are in the moment.
Yeah.
And that some of your greatest teachers are actually teaching you how not to be.
Yes.
And recognizing that is, I think, an important point. That I think when you're younger, you don't realize, because you just want sort of this semblance of perfect to follow.
Yeah.
And then every now and then there's something that doesn't work, but there's a lot to be learned from that.
Yeah, I think so too. Now, do you tell your kids that they can only have 2 career options?
Right now we're at the you need to go to college phase.
Yeah.
No pressure. I do. I'm sure I unintentionally apply pressure. Probably just even by what I do.
Yeah.
So, I'm sure there's a little semblance of pressure. The other thing that's really been interesting to be cognizant of and to learn and to be purposefully thoughtful about is, how I conduct myself, what I feel is reasonable workload or reasonable responsibilities isn't everybody else's.
Yes.
And I can't judge, so to speak, if that somebody's not pulling their, because what I do is kind of crazy.
Yeah.
I mean, and so not everybody's going to do that. Not everybody should do it. Maybe even I shouldn't be doing it. But you can't project your own onto somebody else, and so you have to be pretty cognizant of that.
Yes, that is huge, and that's something that I see a lot of leaders struggling with, in terms of just whatever their expectations are for themselves. And a lot of times, you end up people who are normally high achievers end up in, roles where they are leading other people, some of which are similar to them personality-wise, work ethic-wise, and sometimes different. And, I've worked with so many different people in my career. I remember one person that I reported to, she just, it was really comfortable for her to work 16-hour days and didn't seem to lose stamina or mental acuity. And I'm like, okay, I need a lot of breaks. Like, my brain doesn't work that way. I'll work 16 hours and I am not afraid to work hard, and I like to work hard. But I can't work 16 hours continuously without I just know myself. I will, but you're not going to get peak performance out of me. But what you're talking about requires a ton of maturity from a leadership perspective to recognize, just because I am willing to do this and just because it works for me doesn't necessarily mean it's going to work for everybody on my team.
That's right.
And that can be hard too. Because
it doesn't mean that you don't have the thought, but you can't. You can't do that. You can't do that.
But I would imagine that you still set standards.
Oh, sure.
Even though it's not like you can't just everyone just do the best you can.
I think you set standards. I don't sit down at a table and say I expect this, and this, and maybe there's some ambiguity or lack of clarity by not doing that. But I also think people should have the flexibility, within reason, to be able to perform at their best in the manner in which they perform at their best.
Yeah, and know what that is.
And to know.
Yeah. I'm curious how you maintain that for yourself, because I have a feeling you spend a lot of time taking care of other people. And I'm real curious what you do to take care of yourself.
Probably not enough. I think for me, my family actually helps a lot.
Okay.
I met my husband later. We haven't been married. I was older when I met him, and I always thought I was a good daughter and sibling and stuff, but it wasn't until I had to focus on somebody else and his children from his first marriage before I realized I was pretty self-centric. I knew I took care of other people, but But I could eat when I wanted to. I could
Oh,
sleep when I
yeah.
wanted to. I mean, you had all this
didn't have to
independence.
consider anybody
So,
else.
right. And so I think
Yeah.
having a family that, again, that supports you but pushes you, it's sort of the happy place where you feel like you're okay.
Yeah.
The other happy place is actually in the operating room for me. Yeah. So it's home.
Yeah.
It's home. It's a modestly controlled environment with a bunch of people who are your people, and everything else pretty much gets funneled out. You're just there. You'll lose track of time. I mean, the whole 9 yards. So it's kind of a safe place where nobody can pick at me.
Yeah.
There are times where your data entry points are innumerable.
Yeah.
Text message, email, telephone,
Yes.
inbox.
Meetings.
There are lots of entry points to a
Yes.
person, and in the OR there aren't any because you aren't answering a pager, you aren't answering a telephone. You're just doing one job, and that feels good. I mean, should I run more? Absolutely. Should I exercise more? Absolutely.
Thank you, as a physician, for admitting that you're not perfect either.
Oh God, no, far from it. I really, in the spring, I love gardening. And so, my husband will joke, but I'll be out almost before the sun rises.
Yeah.
And so I love gardening. And the other is I tend to get up earlier than everybody else.
Okay.
And so my sort of quiet time is early.
Yes.
And sometimes I use it to work because my brain settles down a little bit because I know I've tackled the things and I can spend the rest of the day free of that sort of underlying guilt.
Yeah.
So probably my self-care time is taking that early morning time to organize my thoughts and to...
Then you can focus on the things that are important to you. Yeah. I had a boss that I worked for one time who was also a mom, and I think I was just trying to figure out, how do you do it all in a day? And, should I join the PTA? All those questions. And she's like, and I noticed that she would always get up really early in the morning. And so I thought, maybe I'll try that. And so I started getting up at 4:00 in the morning and just getting some emails done and having my coffee and all of that. And I mentioned to her, I said, hey, I really like starting my day this way. And she was like, better to be on top of your day than under your day at the end.
Yeah.
And I was like,
that
makes some sense.
Yeah.
And then you're right. Then you can kind of focus on, okay.
Yeah.
Because I'm fascinated. So when you're talking about being in the OR, just because of course I've never done this, obviously. I mean, do you get like hyper focused, or do you kind of zone out because you just intuitively know what you're doing? I'm so intrigued by just kind of how I think your brain works while you're doing that.
I think it depends on the case and what you're doing. So you also have to be zoned in on what you're doing, but you also have to be aware of what's happening around you as well. So, because the patient's under anesthesia. So, what are the clues that are happening that maybe the patient is struggling under anesthesia? What does that look like?
Yeah.
You have to be aware of those things too. I think the more challenging a particular portion of a case, the much more like laser focused you end up being. And when you have a really good team in the operating, like a really good scrub tech or scrub nurse, they'll oftentimes hand you the instruments you need without ever asking for them, or in my case, ask for the wrong one and they hand me the right one. But it's a real team. It's like a unit that functions, and there'll be times, where the words don't come quickly because you're thinking about something else. And so, this means I want a needle driver for a stitch, and this means I want the bakies, and this means I want scissors. And so you don't even have to verbalize. You can just, so it's a unit that works beautifully together.
It's very well orchestrated.
Oh, yeah.
Wow.
Oh, yeah.
That's just amazing to me just to think about. Because obviously I know you're probably not like, wonder what I'm going to have for dinner tonight. But at the same time, it's interesting because it almost seems like that's a place for you to I don't want to use the word relax because that's not the right word. But you know what I mean? It's almost like you settle in a sense, the way you describe it. That's what it sounds like to me, which is really neat. I feel like I would be a nervous wreck, which is probably why I don't do your job. Was it meant for me?
Yeah. I mean, I think, the other is that we know each other.
Yeah.
I mean, I've always, the other, when I started practicing early, and I think I still do this, is you'll get far more from somebody if you give them a little of yourself.
Ooh.
So, and it can be little things like, my niece, who, God, is almost 12, when I was just the proudest aunt in the whole world. And so I would show pictures of her and talk to patients. And there was one very memorable moment where the last patient of the day, and I was way behind. So, and I wanted to try to hurry and get her out so she could get out because she'd been there for forever. And so I kind of rushed in and was talking to her, and she stopped me in my tracks. She goes, "How's your niece?" Aww. And I was like, "Oh, hold on." And so I went and got my phone and showed her pictures, and then she showed me pictures of her grandchildren, and it was a moment where I was like, this is more about like all of it and not about one specific thing. And so when you give, it means you're indicating to somebody that you trust them with that knowledge about yourself, and so therefore they can do it back. And so I mean, we are, on each team, relatively open book. I mean, not all open book, but if you wall yourself off, it doesn't work.
Well, I'm talking about trust again, but I mean, in order to perform the way you all do as a team, there has to be a high level of trust. And in order to get to that high level of trust, you have to know each other pretty well to build that comfort with each other and that safety, because otherwise, you don't want to be in there thinking like, is this person here to hurt me or harm me? Can I?
Yeah, no, you can't. You can't.
That's not helpful.
I think, on the mom, and I think one of the other important things is everybody does it differently, and it's okay to do it the way you're doing it. Yes. So everybody tries to impose, well, I did this and I do that. And I'm at fault too. If somebody I know is pregnant and I'm like, oh, you need this. And I'm like, okay, Anna, shut up. You didn't like it when you didn't like it when they were doing it to you. Don't do it to somebody else. And so, I think oftentimes we judge ourselves against others.
Yes.
And at the end of the day, it has to be what works for you, and only judge yourself against yourself.
It's so true. It's so true, because I think about that too. I feel like my son's old enough now that I'm already like, do I have regrets about his childhood? Are there things that I feel like I should have done differently? There's a lot of studies about how you have to eat together at a dinner table every night, and we don't always do that. I mean, I sit there and then I'm like, will he be in therapy someday because we didn't do that?
But then you stop and you think, okay, he's in high school. He plays sports. He, da-da-da-da-da-da.
Yeah.
Kid's okay, right? There's this perception of how you should parent and be. I mean, my impression of myself as a parent is very different than the reality of myself as a parent.
How so?
Very different. Oh, I was no screens, no sugar, I thought that was actually possible.
Yes.
It is not.
Same.
It is not. So, again, I have to give myself a little grace when, when my kids got the iPad because we're at one of our older siblings' games. I mean, it's boring for her.
Exactly.
But anyway, you have to kind of, I don't know.
I love that realism, though, because I think that's what people are missing, especially with social media. They look and they see this adulterated version of what a person's life really is, and it's like, oh, I could never be something like that, or I'm failing in all these areas because I'm not like that person. And it's like, everybody's got issues. Nobody's perfect. There is no perfect mother.
I can be a hot mess. I mean, let's just be very clear. I can
too.
I can be a hot mess. It cracks me up.
Hampton knows.
Yeah. So, again, in the OR, very singularly focused, out of it, when your brain's moving in 500 different directions. Yeah. My husband laughs because it usually takes me 2 or 3 times to get out of the house because I'll forget my keys or I'll forget my this or my that. So
you make me feel so much better about my life.
And I just say it's an opportunity to say goodbye again.
Exactly.
You make it what it is.
Oh my gosh, that's hilarious. This is I love your humility and I love your authenticity. I just think it's I can only imagine how much your patients love you, because, you know, people do want to feel, they want that human connection, and they want to feel like you're a real person, and, you know, not like this like Dr. Robot that, you know, you've certainly put in the work, put in the time to be an expert in your field, but at the same time, you're still saying, like, listen, I forget my keys too. It happens. I got a speeding ticket too, you know. No. We're not perfect. And I appreciate that.
No, not at all.
I think that humility and that vulnerability, people really appreciate that. Yeah, for sure. Yeah. So I know you still have a lot to go in your career. You're certainly not at the end of it, but you've accomplished a lot so far. And so I always like to think about legacy. Yeah. And I'm sure that's a hot topic in your world anyway, as you talk to patients and different people. But, you know, as you kind of think about, you've already had such an impact, but what do you hope, you know, if you could hit the fast forward button and you're, you know, moving on to something else, what do you hope that your legacy will be within this role?
So first of all, I don't know that I'll ever be great enough to have a legacy. Aww. But what I hope at the end is stability. And I hope for improved cancer outcomes in the state and in the region. And I hope that we figure out different ways to deliver care. Yeah. Different ways to meet people emotionally and physically. Yeah. You know, we started out with house calls, and then we built these big like mega centers, and I think there's the right spot somewhere in between. Yeah. Not everybody has to be at a mega center. Yeah. So that I think would be, I'd be happy with that.
That's amazing. Yeah, well, I think I am so excited to hear just about the impact that you've had on the state so far and beyond. I mean, I know the focus is West Virginia, but I know people come from other states as well. So the ripple effect of the work is really inspiring.
Yeah, I hope, you know, right now there's a lot of talk about NCI designation, which is where, you know, the national government basically looks at the way you take care of patients and research patients and educate and determines whether or not, and it's a grant application that you get or you don't, and there's a lot of discussion in the last 6 to 9 months about that here in the state, and I hope, you know, the other part of the legacy or whatever you want to call it is that as we build that, people know we built it very purposefully to meet the needs of here, and that at the end we set ourselves up to be able to apply for the grant, as opposed to here's the shiny star.
We just want to win an award.
What does it take to get there? But and that's where I meant by stability, so that foundation becomes more and more firm. And then that again, when, you know, there's always leadership shifts, you know, you always have to sort of think one step forward for yourself and for others. And, you know, there'll be a day where, you know, none of the existing leaders, you know, in our healthcare system, just in general, not specific to any one person, won't be there. And the you know, the intention should be that it moves on without you. That it wasn't built around you. Yeah. But it moves on without you.
Yeah, there's a good leadership book that was written by Frances Fry and Ann Morris, and they talk about leadership in your absence. And so they were looking at studies on what happens to a team's performance when the leader leaves. And you know, just maybe human nature, but sometimes we want to believe that we have such an impact on people that their performance will go down when we're absent from them. But their premise is actually you should want the team's performance to go up after you leave. That's the true mark of good leadership.
Yeah, what a compliment.
Is that, their performance has been improved in your absence, not just because of your presence there, which I think is a different way to think about it, but just made me think of what you were saying.
No, I agree with that completely.
Awesome. Well, I think that I can just imagine the impact that you've already had on people and more to come along those lines.
We'll see. Yeah.
Anything else you wanted to cover today or get out there? I've just so enjoyed getting to know you and seeing this side of you. I mean, we were talking about, I know a lot of times when you're in the media, it's obviously to talk about the good work that you all are doing at the Cancer Institute, but you're as an individual as a part of that too. And I just wanted to shine a light on you.
Pluses and minuses.
Exactly.
Yeah. No, I mean, I think it is, again, for me, is organic to a point. And once you get to a certain point, you have to be purposeful.
Yeah.
You can't let organic kind of rule.
Yes.
Or instincts rule. So again, that's been a shift for me, is to be very purposeful about thinking about leadership and how I want to be perceived as well as be.
And recognizing the responsibility that you do have for others.
Correct.
That's amazing.
Yep, correct. So
wonderful.
Good.
Thank you. Would you be willing to do the lightning round?
Oh, sure.
Okay, I'm excited to hear your answers to this. So this is 60 seconds to answer as many open-ended questions about you as you can. So I'm going to pull up my timer. And I mean, act like it's a competition, but it's kind of not. But all right.
It at least puts parameters on it,
yeah,
right?
it's just you're competing against yourself. So
there's an end time.
Yeah, just a minute. All right, here we go. What season best fits your personality?
Oh, I love spring.
Oh, what's your most used emoji in text? Or do you not use emojis?
Not really.
Okay.
Maybe a heart.
A heart. I like that. Okay. What book, song, movie, or podcast has had the greatest impact on your life? That's a tricky question.
That is a tricky question. I used to read Pride and Prejudice like ad nauseum. So anytime I got stressed out, I'd pull out Pride and Prejudice to start reading. So I've been known to be in the corner of the OR when it's not going well with my patients. I'm back in time and I'm like reading Pride and Prejudice. So that's
calming.
So that's definitely the book. I loved Princess Bride when I was little.
Yeah. That's a good one too. Okay. What's something about you that surprises people when they first hear it?
Oh God, I don't know.
Your facial expression was really good on that one. Oh, the timer.
I don't know. I didn't get through many questions, did I?
Well, I'll tell you that third one stumps people usually.
Yeah.
And so, not to worry, because we can have you back and we can go through the next round of questions too. How about that?
Great.
Yes.
Sounds good.
Thank you again so much.
Thanks for having me.
Here.
I appreciate it.
Yeah. That's all the time we have for today. Until next time, keep shining, everyone.